Hi, welcome back to Kari's Dental Pearls. Today we're going to be talking about piriformonas gingivalis and Alzheimer's disease. Piriformonas gingivalis I'll refer to as P. gingivalis. It's an oral bacteria that is one of the big five associated with periodontal disease. P. gingivalis causes red, bleeding, swollen gums, and bad breath. There used to be just a association between P. gingivalis and Alzheimer's disease, but things have really changed, and they have found that there's actually a positive correlation between P. gingivalis and Alzheimer's. So what happens is when you have bleeding gums, you basically it's now called something called leaky gums. Basically, you're opening a portal for bacteria to enter into your cardiovascular system. Now, typically, you have something called the blood-brain barrier, and this is what protects your central nervous system from toxins, bacteria, what have you, that are floating around in your cardiovascular, your blood supply. The blood-brain barrier is semi-permeable, highly selective, but they have found that P. gingivalis and its enzyme called gingipane can actually enter through the blood-brain barrier and get into the central nervous system. Gingipanes are an enzyme, and they cause amyloid plaques and neurofibrillary tangling. That's a hard word for me to say. They have even done spinal taps on Alzheimer's patients and found P. gingivalis in the cerebral spinal fluid. So if you have a family history of Alzheimer's, it might be a good plan to do something called an oral bacteria assessment. At our office, we offer the Bristol oral bacteria testing kit. What's really important is if you want to take this test, you can't take it after you've had your teeth cleaned or you've used mouthwash or you've brushed your teeth. You need to keep everything out of your mouth for at least 30 minutes to get an accurate test. So if you do have P. gingivalis, what can you do? Well, the first thing is talk to your hygienist. This is what they do. Second thing, you can look into an oral probiotic treatment. I personally like Probiora. You can order it online. It has most of the beneficial oral bacteria. You definitely want to make sure you're flossing, brushing, using a water pick, which, by the way, water pick does not replace flossing, and definitely use your copper tongue blade. Notice I'm not saying use mouthwash. We'll discuss that in a few weeks. Until then, keep flossing.